Igoti guteaniria kamite iria yombirwo ni minista ogima wa mwiri Adan Duale ya guthurima mathire ma ciringi bilioni 33 ma NHIF. Mwihoko wao ni ati thirikari ni kumariha mbeca ici kuna mathibitari maingi mari na morito oho maugite ni monete bata wa kwambiriria wabici cia kuheana motaro kuri arwaru mathibitari-ini maya maithiramu.
Thutha wa igoti guteaniria kamite iria yombitwo ni minista wa ũgima wa mwĩrĩ Aden Duale ya guthurima mathirĩ ma ciringi bilioni 33 ma NHIF, riu thibitari nyingi ciaya gweterera makiria kugia na mwerekera wigie kurihwo kwa mathirĩ maya. Makiaria hindi ya kigomano kiria gikurehete hamwe anyiti itemi matiganite sekta-ini ya ũgima wa mwĩrĩ, urugamiriri wa mathibitari maria mari rungu rwa gikundi kia itheramu SUPKEM maugite thiri uria matarihitwo wa NHIF ni makiria ma ciringi milioni 300, makiuga mari na mwihoko thirikari ni kumariha mbeca ici.
We're waiting for government directive on the next step. But I guess they're working on it. Yeah, we believe it will be worked on. We have over 300 million for some few facilities.
Kwaga kurihwo kwa mathirĩ maya na riu gukorwo makiheana motungata rungu rwa SHA ni undu urituhitie mirutire yao ya wera, indi makauga oni mehothete kurutithania wera na thirikari na gutungatira muingi na njira igwete.
Of course, what is pending is a huge amount of money, and that will greatly affect the services that we're delivering. Facilities have had SHA claims that were being processed, are being settled, and the rest we're working on. We have some few hiccups here and there.
To accelerate universal healthcare.
Ya uciothe na muoroto wa guteithia arwaru.
The Muslim faith has been lagging behind, has been left out, and we're trying to strengthen that. In as much as our colleagues, our brothers and sisters from the other faith are benefiting from counseling services and religious counseling and so on within the hospital premises for the patients and for the staff. We've also asked the CS, we proposed a plan to have a framework so that at least the Muslim chaplains are also enrolled and employed. Patients undergoing surgeries and so on. Majority will require counseling, and as human nature they will wish to have somebody from the same faith.
Anyiti itemi matiganite makigweta bata wa mathibitari kunyitanira nginyagia na thirikari cia kaunti niguo gutigirira muingi ni urakinyirwo ni motungata maria marabatara mateguthinika.
SUPKEM can use its comparative advantage to influence uptake of HIV services. As we know from data that in terms of initiation to treatment, this remains very suboptimal, especially in arid and semi-arid areas. Currently, even the transmission of mother-to-child transmission of HIV still remains high.
Gerifotera Kameme TV ni jetagwo Wagoi wa Muiruri.
Thirikari ya kaunti ya Nairobi ni hingite kigongona kinene kia Freemason guku Nairobi kwa ihinda ritoekaine kumana na kwaga kuriha thirĩ wa igoti ria tĩri wa milioni 19. Kuhingwo gwa kigongona giki giukite thikũ imwe kuma mihang'o ya kuhitana na onjoria na ene manyumba aria matakoretwo makiriha magoti maya maria macungagiriria kaunti korwo ni muigana wa ciringi bilioni 60 harĩ o mwaka. Birigiceni ino no igatwarithio na mbere muthenya wa rucio.
My name is Susan Silantoi. I'm the CEC for Health, Wellness and Nutrition, but for the purposes of this exercise, we are leading the Dagoretti North Sub-County team for the revenue drive. We are here today because this particular parcel of land has not complied. They owe the county about 19 million Kenya shillings in land rates, and so we are here to just ensure that they also comply. This is one of the many parcels of land that we will be visiting, together with all our revenue streams as well, to ensure compliance. In terms of paying in installments, the law actually allows people to pay land rates for the first 10 months of the financial year in installments, but the last 2 months are actually set aside for enforcement, and hence why we're carrying out this exercise today between these 2 months that are left in the financial year. However, we understand that quite a number of people have very large arrears because of the lack of compliance. If you make contact with the customer service center, or you log on to www.nairobipay.go.ke, you will actually just get help in how you can be able to pay, even in installments. We are not here to punish, we are actually here to ensure compliance.
Everybody to pay their fair share. You cannot have drainage in Kilimani blocked that is being cleared with resources that are being collected from a mama mboga who lives in Mukuru. I think we need to flip that. You can't have a large landowner or developer in Kitisuru who is not paying land rates, is not paying any dues. All the businesses in the building that they have constructed are not compliant on UBP. But then you have the Wamama Soko in City Park, in Mudhurwa. Every day they are paying that cess. And that cess is what we are using to collect garbage, to clear the drains, to pay staff, to populate the hospitals with medicine. So there is a lot of unfairness where the burden of providing services in Nairobi is being borne by very few people.
Tugitigana na riboti yo tuigire iharo-ini citũ na timu ya bũrũri ya mũbira wa gonya wa athaki 15 o mwena Kenya Simbas makanyita ũgeni timu ya mabũrũri ma Kiarabu tarĩki 24 mweri ũyũ mbere ya kumagara nginyanagia bũrũri-inĩ wa South Africa kwa ihinda rĩa mweri ũmwe kwĩharĩria mbere ya kũnyita itemi ngucanio-inĩ cia gwetha tigiti wa World Cup ya mwaka wa 2027. Timu ĩno rungu rwa Jerome iri kambe-ini ya meharĩria mwena wa Kakamega mbere ya ngucanio cia Rugby Africa Cup mweri-inĩ wa 7. Ngucanio iria ihũthĩkaga gwetha tigiti wa World Cup ni mabũrũri ma gĩtarũ kĩa Africa. Ngucanio ici igathakĩrwo bũrũri-inĩ wa Uganda ngucanio-inĩ ya mbere.
Looking at the camp and looking at how it has been so far, we're quite optimistic around the Simbas going into the World Cup qualifiers. Obviously, we need to pick up the paces in South Africa and play the games at a higher level over the next couple of weeks. And obviously, once we go into Uganda, the team will be well prepared for the World Cup qualifiers. And I think it's a good time.